Every day, nurses change lives. They overcome challenges set before them to reach each one of us, to advocate for health for all, and deliver the vital care we need when we need it, wherever we are.
The work of nurses goes so much further than just health. They're champions for rights. They're upholders of fundamental principles about non-discrimination, equity, access to health care. About half the people around the world don't have access to fundamental health services. Nurses are absolutely critical to ensuring that people can access healthcare when they need it, at the right time, not just for themselves, but also for their families, for the communities that they live in.
Nurses are creating new opportunities to provide care to the people most in need. Nurses are leading the way in many areas of care. It's important that nurses share that knowledge at every policy table and every strategy in relation to healthcare.
Health for all is not an endpoint, but a call for action in the area of social justice, with the core principle that all countries and the international community should seek to improve people's health.
We need nurses who are also in leadership positions. At every seat where decisions about healthcare are made, you must have a voice from nursing.
What we need is investment in nursing. We need to build the capacity of nurses. We need to retain our nurses, and we need to provide adequate resources for nurses to remain in the profession.
Nurses are a powerhouse for change. Every day, individually, you are changing the lives of people all around the world. Nurses are a voice to lead.
Nurses, a voice to lead, health for all.
Les infirmières, une voix faite pour diriger, la santé pour tous.
Enfermería, una voz para liderar, la salud para todos.
Join us in raising the nursing voice to ensure we deliver health for all.
Good afternoon, dear colleagues, respected speaker, friends, dear guests. Welcome to our afternoon session. This is the main session number 4, and I hope that you spent a nice lunchtime and that you are ready for our 3 speakers from different countries. It is our second day here on this fantastic Congress. I'm sure that you enjoy very much. This is the Congress where each lecture counts. Are you agree? Yes, it's not so easy to come here and speak, especially for us who are not fluently in English so much. So I'm Brigitta Skila-Savic. I'm not Rosvita, because you have Rosvita maybe in your materials. I come from Slovenia. I'm a full professor in nursing research, evidence-based practice. I'm a researcher and expert in nursing education and nursing development in our region. Do you know where is Slovenia? Yes? Sometimes there are misunderstandings. Slovenia is a former Yugoslavian country in Central Eastern Europe. So I'm coming now to our speakers. Our speakers are going to present 3 different topics, very actual topics. The first topic is ethics, and the first speaker is Professor Mavis Mulaudzi from South Africa. I have a little problem first time. Maybe I will do it better second time. She is the head of the Department of Nursing Science and chairperson of the School of Healthcare Sciences at the University of Pretoria. She is chairperson of the Forum of University Nursing Deans in South Africa. She is a researcher with interest in human rights and ethics, AIDS, reproductive health, and so on. The title of her lecture is Beyond Principle-Based Ethics, an eclectic approach for nursing ethics. Please, Professor, the podium is yours.
Good afternoon, colleagues. Good afternoon, colleagues. Thank you. My topic is on Beyond Principle-Based Ethics, an eclectic approach to nursing ethics. I'll talk about the introduction, and I'll give you an overview of principle-based ethics, the evolution of nursing ethics, the proposed eclectic approach, recommendation, and the conclusion. In this paper, I want to argue that principle-based ethics have always been the most common guidelines or framework used in nursing ethics. Principle-based ethics has set the standard that not only articulate the ethics of care, but provided a common pool of intellectual resources for theorists and practitioners of nursing. However, one other thing that was not said is that I'm now the first deputy president of our nursing association, DENOSA. So I'm going to approach this from an advocacy position to try and propose and advocate for the inclusion of the African philosophy of Ubuntu as the foundation of caring ethics in this nursing profession. If we talk about beyond principle-based ethics, it's not a call to jettison the practice. We don't want to abandon it. It has been there, and we still want to continue it. But it is an invitation to recognize the changing context of nursing. We are currently living in a diverse, multicultural society. And if you look, technology has also brought new ethical challenges that we didn't have before. We were just in a policy cafe just now, and there were issues that were raised regarding the issue of technology and the ethical challenges that it is bringing to the nursing profession. The question is, what ought to be and what guidelines are needed to influence moral decisions? Yes, we have to rethink our ethical practices. Indeed, nursing ethics was based on normative principle basic ethics that emanated from philosophy and medical sciences. And these principle-based ethics were based on Western method epistemologies, which emphasizes human rights and individual autonomy. For us, for example, in Africa, we adopted morals and ethics of caring from ways of knowing which differ from our own, and thus alienating us from the communities we serve. The liberal issue of respecting human rights and also respecting individual autonomy is not within our cultural beliefs and practices. And this has made us to overlook the cultural practices and beliefs of those that we have served. The essence of caring, which defines and symbolizes nations, were introduced only in the 19th century. And these are the new theories that can strengthen the ethics of care. Let me just give you a brief history of why did we find ourselves following the principle-based ethics. I think Beauchamp and Childress, they published the first edition of principle-based ethics in 1979 and emphasized the respect for persons, beneficence, non-maleficence, and justice. And in the same year, the Belmont report in terms of research was also published, and it emphasized respect for persons, beneficence, justice. Indeed, these are the principles that were used all along, and we are using them. But sometimes they provide a lot of challenges. They do not provide us with exhaustive account of how we can use them in terms of moral reasoning. In certain cases, you'll find that the two principles conflict each other when you want to make a decision. And it's difficult to balance, and your balance depends on your intuition. And in most cases, we have ethical theories and also ethical decision-making model that assist us. These ethical principles are also not ranked. So in a process where you want to make a decision-making, it is difficult for you to make such a decision. And they also emphasize individual autonomy. However, nursing is an evolving and dynamic profession. We had a lot of ethicists who tried to look at what are the methods and what other ethics methods or principles can we use to try and see the nursing part, the caring part. So we have virtue ethics, we have ethics of care, and we have relational ethics that has already been introduced in the ethics of care. Based on time, I'm not gonna really go through each and every one of them, but virtue ethics emphasizes the innate being, the virtues and the values that you as a person embodies. The ethics of care is relational. It's about recognition of situatedness. And relational ethics is about issues of relating with others, engagement, mutual respect, and also recognizing the environment. Ubuntu is also alongside or alternative to a PBE. As I've already said, I'm not saying Ubuntu must replace the ethics. I'm saying it must be part, and it must not be part only rhetorically. It must be written, it must be taught, it must be infused in our ethics. This Ubuntu can be described as an indigenous way of being that is unique in Africa. And it emanates from an aphorism that says, umuntu ngumuntu ngabantu, which means a person is a person through other persons. I am because you are, and you are because I am. And I think you will agree with me that as a nurse, that's how you feel immediately when you see a patient. You feel that this person is here because I am, and I am because of this person. It emphasizes relationship with the others, the living, the dead, and nature. And if you look at where health is going now, we are talking about One Health, where we recognize the plants, the animals, and also the air. So that on its own tells you that Ubuntu is a philosophy that we have to adopt globally. Ubuntu ethics is defined as a set of values, central among which are issues of reciprocity. We talk about caring for others, but we also say, as nurses say, the caring must be reciprocated. I must also be cared for as a nurse. We talk about the common good. We talk about peaceful relations between people. We emphasize the issue of human dignity. We value the human life. And we talk about consensus in everything that we are doing, and tolerance and mutual respect. Respect must not be coming from patients only. I also have to respect those patients for them to respect me. These are the tenets of Ubuntu and the principles of Ubuntu. I'm not gonna really talk about this. I will apply them as I continue. Ubuntu must be used as, we argue that Ubuntu cannot completely displace PBE. Ubuntu brings a cultural and philosophical understanding of communal and social relations that emphasize personhood and community. It provides us with another angle from which the basis of ethics For example, using it, one can then examine what is good for the individual, understand how individual and social goods contribute to the building of the person and community, offers a straight point to negotiating the common good and social goods. And when we talk about Ubuntu, we are not saying Ubuntu is only communal. Ubuntu is about understanding that a person is an individual and that individual relate with others. That understanding does not negate or doesn't take away the individualism of that particular person, but it's just to have that consciousness that I exist because other people exist. Ubuntu grounds the necessity of an eclectic model, because we realize that can a single model assist in instilling the caring ethics in the nursing profession? Can the allow me to call them PBE. Can PBE continue to be applicable in different contexts without contextualization? Similarly, can Ubuntu be applied without taking cognizance of the principle-based approach? What do different systems hold in common, and where do they diverge? I think this eclectic approach is about putting things together, putting all these ideas together so that we can have one global ethics in nursing that resonates to all of us. Ubuntu strengthens an eclectic approach. This is a new dimension which uses a philosophical underpinning of the ethics of caring. It includes all epistemologies. There are similarities already between ethics of care, relational ethics, and Ubuntu. They are both relational, dependent, interconnected, and reciprocity. And there's also similarities between virtue ethics and values of Ubuntu. The components of the eclectic model is about incorporating Ubuntu, virtue ethics, principle-based ethics, relational ethics, and ethics of care. We could have a beautiful tree with different colors, but the basis of Ubuntu will be the education that we are giving to the students in the class when we socialize them. It is very, very important for us to socialize our students in an ethically so that they could have an understanding from the beginning. That's why I'm putting the Ubuntu here as sort of like towards this as a stem. And then we have, if we have a good foundation in ethics, we'll definitely have branches, we will have leaves that are full of values and tenets that we really need in the ethics of caring. Ubuntu is about, if we are applying it into nursing, it's about understanding that a person has her own identity. And we affirm her own identity, but that is affirmed by acknowledging the relationship with other person. The individual's life has meaning with the context of the meaning of others. And the history and background of a person determines how they adapt and cope in different circumstances. There is a sense of obligation and belonging to a group. And solidarity with others is essential to communalism as an ethos. I think this is just to show you how we can look as a person. She has got identity, she comes from a context, she has got a background, she has got history, and obviously she has got needs. And Ubuntu and the nursing profession is about the ability to understand and identify needs, ability to communicate with those that we are nursing, and ability to understand it can be used as a tool to understand our patients. If you look at this diagram, it's about the patient, the nurse, and the family. But for you to be able to assist these people, you need dialogue. And that dialogue cannot be the dialogue that is going to end between us and them. Our main aim is to affirm them, to enable them, to emancipate, and to empower. And that's what nursing is all about. Nursing is about affirming what the others are coming with, enabling them, empowering them, and emancipating them. And then we have the society. The individual exists in a liberal society. However, he has an obligation to that particular society. The individual depends on society to achieve the fullest potential of his ability. And if individuals accept that and understand that, then they will be able to give back to their communities. They will be able to understand why they have to be part of what is happening in society. The responsibility to play a part in the development of society, and it is a social and ethical principle that tries to define the place of an individual as a primary element of social order. And the health is about the welfare of the group is greater than the welfare of a single individual. We need a sense of harmony or unity, and this must be the common purpose that nations strive for. And my recommendation is that we have to continue with this Ubuntu and ensure that we mainstream it in what we are doing, and also in research, leadership, practice, and education. In education, I've already said it must be the primacy of value in the socialization of Nasir. In some communities, the religious values remain pivotal as long as they are not exclusive, and we have to see how we're going to deal with that. Ubuntu offers both dimension of the personal and communal, and mainstreaming of Ubuntu in nursing education must be something that we try. We are going to 2020, that this is something that we can look at. Can we think of doing this? The issue of research is also very important, the relational accountability, the respect for representation, reciprocal appropriation, and rights of regulation when we do research in other communities. I think is really, really very important. We cannot continue coming to or committing to global research if we do not understand and value other people's theories. And in leadership, the policies must reflect Ubuntu, and the practice of nursing care must also resonate with the Ubuntu and what it's all about. In conclusion, our deepest moral obligation, it is to become more human. And I think we call it to become Umuntu. And Umuntu must be the person that is understanding the values of ethics and living that Ubuntu guided by wisdom. As nurses, we have to adopt the we thinking rather than the I. Instilling Ubuntu ethics among our young nurses that would like to socialize will assist us in taking the profession forward. Thank you.
Thank you, Professor Mulaudzi. I admire your run for the Women's Science Award in 2011. We need more nurses in clinical settings, but we need more nurses also in science to develop nursing as a scientific discipline. So, run up again. Now we are here to listen next speakers. Next speaker. This one. The second topic is primary health care and universal health coverage. The next speaker is Jolanta Bielinska from Poland. Jolanta Bielinska is a past chair of the International Alliance of Patient Organizations. Currently, she is the Director of Development and Social Communication at the City Medical Center Lodz in Poland. She has a master's degree in clinical psychology and is interested in matters relating to patient rights on the way they are observed in healthcare system. In 2006, she established Patient Safety Foundation, whose main aim is to promote safety measures in health services as well as to involve patients in the process of treatment. The title of her lecture is Role of Expert, Patient and Nurse Partnership in Primary Health Care and Universal Health Coverage. So, Ms. Jolanta Bielinska, the podium is yours.
Good afternoon, ladies and gentlemen. First of all, I would like to thank you to organizers for time for me and for invitation to such great event. I don't remember such big congress for a very, very long time. I represent International Alliance of Patient Organization, but I was very happy that they invited me because for the last 2 years I am a lecturer at high school in Poland for nurses. So I know they are nurses who work and they want to be a master. So this is a next degree, and we talk very much privately what are the issues most important in everyday work. As International Alliance of Patient Organization, I represent advocate for a patient around the world. We have 268 organizations, and we have it in 71 countries and across 52 disease areas. It is a really very big organization because one of our members has, for example, 1 or 2 million members, because this is International Diabetes Organization or other NCD like Cancer Organization, etc. It is important for us to work with the main vision to see patient at the center of the healthcare and to build a partnership with others to build patient-centered healthcare worldwide. How we do it? As you know, because you have contacts with patients every day and in every moment, and you know that sometimes people, if they are in bad condition or especially senior patients, sometimes it is difficult to communicate with them. That's why they need or support with friends, family, or with patient organization. Patient organizations are very crucial in every hospital in which they are actively working. I noticed there is much better communication between healthcare and the patients. So I admire very much if after, when you come back home, you check in your hospital how many organizations you have, or it is stroke organization, or it is a patient organization for rehabilitation, anyone. But if you have this organization, try to be in touch with this organization, but because they can help and support your everyday work. So we have also a connection internationally. Our main partner is World Health Organization. We are, as IAPO, in official relation with WHO, but we are also in a relation with International Nurse Organization, with International Hospital Organization, Family Doctors Organization, Pharmaceutical Organization. So we are all internationally connected because our main core is patient and the best interest for patient. We also built cross-sector alliances for health professional, policymaker, academics, researcher, because only this collaborative work can bring a full picture of the patient needs and of work which we should do. We try to be as much as possible on international fora. As I mentioned, WHO is our main fora to do the policy work and different statements, what is necessary for patient organization. We can present at WHA Assembly in Geneva. It is always in May, and every country almost sent their representative. They are 194 governments which sent their representative there. care. If somebody has something very important to present, can apply before, like YAPO is doing every year, and then it is a chance to have our side event or have a statement which is disseminated around all delegates. It is very important. I don't know if somebody is working like me many years. You remember before 2005, hand hygiene was promoted, but not so much. Even I live in Poland, and Poland is European Union country. That time we just joined European Union. So really, 15 years ago, no one patient was so courage to tell to the doctor, please wash hand before touching me. Or no one patient even said to nurse, oh, please change gloves if you do an injection to me. It was not common. After 2005, when hand hygiene was promoted by WHO so widely, many surveys, many webinars was done, and this sanitization liquid was promoted around the whole world. Now I think, because I visited also many countries where our members organize things, so I was in Pakistan in Holy Family Hospital, or in Oman, or in India, in South Africa. Everywhere we can see now hand hygiene liquid to wash hands. So this is a milestone, and these milestones are promoted by biggest organization, by WHO. The next milestone was this safe surgery, safe lives. Many of you, if you are a nurses in ICU department, you notice the doctors many times forget to wash hands, and they forget to check if this hand should be operated or this leg should be operated. After 2008, when was promoted this safe surgery, safe lives, it is a procedure. We need to check point after point. And even for nurses, it is much comfortable situation, because this is also difference, because nurses and clinicians, even now in many hospitals, sometimes you are a really equal partner. And if every day in the morning doctors go to see patients, you go with them. But in many hospitals still, first go the doctors, they prescribe what is with the patient, and then half hour after, nurses are going and checking which tablets they need to give to patient Smith and to patients Kowalski, etc. So this is same with this promotion of safe surgery, safe lives. Nurses now know exactly what is the part for them, what is the part for the doctor, how they need to cooperate as a team. The last challenge of WHO is this safety medication. It is last year, 2017, safety medication. And you know, this is also so important, because you represent different regions of the world. And you know, in Africa, sometimes people receive medicine just in a bag, without name, without any description, what is this? So this is a role of big organization, and then other also this patient organization, to promote safety medication, to promote how to take medicine, how to use tablets, how to do with compliance and adherence, that patients know if there is a chronic disease, they should take it regularly, and to listen comments from patients. And nurse is like a bridge between the patient and the doctor. So they are most emotionally, but also most knowledgeable, most intellectual, distinguished to coordinate this simple way in the treatment. So in many, even in countries, well-developed countries, now is the problem with overtaking the medicine. Sometimes people in my hospital, they take 30 tablets, and if you take more than 7 tablets a day, you know there is so much interaction that it is lost. So really, this is important to listen and to have the digital data from WHO and from other patient organizations about how to coordinate this treatment for a patient. So we take also in United Nations General Assembly in New York about NCDs, also in Astana Primary Health Care Declaration, which states that primary health care is the most important pillar in the treatment for patients. And this is important because also nurses which work at the primary care, they have good relationship with community, and they also have a good relationship with patient, because they know this patient. This patient come regularly. If they have chronic disease, they come regularly to the outpatient clinic, to primary doctor, and they know how to convince patient, for example, to take regularly prescribed medicine. We were also on event 4 was last year in Jeddah, the Global Ministerial Summit on Patient Safety. It was also very important meeting because it was decided in Jeddah in March this year that according to WHO data, 134 million people occurs adverse events in low and middle income country. And due to these medical errors, adverse events, 2.6 million people die every year. So this is important to have a safety care. And we all, as healthcare providers, need to think about every step, because even small initiative from our side which promote safety can bring safety for all people. And we were also, as an organization in Tokyo, when we signed Patient Safety Declaration last year in April. So we consult on high-level policy with stakeholders like WHO or European Medicine Agency, and last time also in Africa there is African Medicine Agency. As I mentioned before, the patient-centered health gives some points which should be fulfilled in the healthcare to promote really a patient in the center. It is a respect. Respect means that a patient has their dignity, that if a doctor is coming to the room, he is not saying, hello, grandmother, how are you today? Just how are you today, because it is not grandmother of this doctor. And we also support the choice and empowerment that the patient, sometimes, even in European Union, they are different diseases, and not every disease is so easy to treat. So sometimes the doctor is telling to the patient, oh, there is no chance for you, or this medicine, we don't have a proper medicine, we can instead do this or this. And he is not telling that in other countries of European Union, this is specifically for R.A.D. diseases, there is a chance to treat. And there is a chance through this European law and healthcare in European Union countries that this patient could go even to the US, but also in European Union to specific country. They only need to fulfill a special document, and it takes some more time than usually. So a patient has this choice to choose, and we also empower patient to be more involved in the treatment, to ask some question. And you know, this is very specific and very common, that before a patient is going to the doctor, he first or she first asks a nurse, what can you tell me about my disease? And sometimes even nurses support patients and tell them, oh, this is your doctor, you can ask him about the called coordinated care. So what is after discharge from the hospital? How long you should take your medicine? How long what you should do, which diagnose after 1 or 2 months? So nurses, they don't have so much time for this consulting, but you know, even on the way to this injection or any other part of the hospital, they very often practically support patient. Okay. I don't know. Oh, yeah. As a patient organization, I should be quickly, we organize every second year a patient congress. So for this congress, we also invite nurses, doctors, industry partners, and last year we had this meeting in Miami, and the theme was globally empowered patients building the momentum. They are a small group of participants, not like here, and we decided on this Congress that we need to have a Patient Solidarity Day 2018. We had this meeting and we promoted safe medicine on this day. As I mentioned, we also were in New York for a high-level meeting about NCD, and we participated in all regional committees of World Health Organization. Why is important not only this meeting in Geneva? Because, for example, I was in Dakar in Senegal on African Regional Committee, and on this committee they are coming delegates from the region, from Africa. Then we discussed which diseases are more important, how we can help patients, for example, in this region. I was in touch with our members, and they told that they have 4 devices in Africa for tomography, or people need to wait for opioids are not absolutely not common in Africa for people in palliative care. So all these small issues we collect, and then we present to Minister of Health in the discussion. And you know, believe me, that sometimes help. We had similar meeting in South America. We invited people from Guatemala, from Argentina, Brazil, and also ministries of health from these countries for our meeting. And you know, when they heard in the room like here that in Guatemala you need to wait 2 years for visit oncology if you have breast cancer, it is not imaginable. They promise officially they shorten this queue. So these small steps help in the region to improve the situation. So we also were in EMRO region, in Europe, Southeast and PAHO, and Western Pacific in Manila. Now the most important things, what we decided in 2018, 2020 as a collaboration towards universal health coverage. You know, everybody, what is very simply universal health coverage? It is and access for patients to healthcare without financial hardship. This is more important, that everybody could receive safe care in their country, in their city, in their village, everywhere. And what we will do for this? So we need to cooperate with primary healthcare, because primary healthcare, as I mentioned before, is a cornerstone for healthcare. And we do it through empower patient and patient communities, drive the research process, and shape law and policy practice in a way. As you know, to receive this, we need to all collaborate. And that's why we identified specifically situation, expert patient, who become clinically efficient and effective in managing of their own chronic condition, who are competent and who have insight in the health system. And this expert patient needs to cooperate with nurses, because we both recognize what is the patient healthcare and how important is this for the system. For way forward, health systems are now recognizing as expert patient as equal partner, and health system must create an enabling environment to engage expert patient and nurse in partnership. Expert patients need to be supported with capacity building program. Learning outcomes. I wanted to tell you a last phrase because I am in minus, but it is very important for us to use your, as nurses, knowledge, competence, love in heart, and power to work with patients who are sometimes very difficult to work, but without this patient, your life would be not successful and not professional as it could be. Thank you very much, and I wish you all the best.
Ms. Bilinska, I know that you have a few slides more, but we have learned a lot from you. You had very strong messages for us, and I think all nurses believe that the patients are the huge and most important drivers of healthcare changes today and in the future. So you get it. So the next speaker is going to speak about topics health and well-being of nursing workforce. We all know how it's important how we feel in our job. So we are going to listen the Caribbean experience. With us is Nasir Edwards from Grenada, who is the chief nurse officer in Grenada, has a background in nursing, midwifery, and nurse education. She is currently chair of the Nurses and Midwives Council of Grenada, and she also chairs the regional nursing body. Nasir Edwards has a keen interest in health policy and human resources in health, and has worked very closely with regional and international organizations, and she contributed to several policies for the Grenada Ministry of Health. Bravo. So your lecture is Improving the Health and Well-being of the Nursing Workforce, the Caribbean Experience. Please.
Good afternoon, colleagues. I bring you greetings from the Caribbean. This afternoon, I will be looking at the factors influencing health and well-being of the nursing workforce in the Caribbean, and we will be examining some of the measures implemented by various countries to improve the health and well-being of the Caribbean nursing workforce. Factors influencing the health and well-being of the Caribbean nursing workforce. The health and well-being of nurses are critical factors in health systems development. It became a point of interest due to many nurses feeling stressed and burnout by their work. It has serious impact on the quality of patient care And we know a healthy and motivated nursing workforce can lead to better patient outcomes, decreased turnover, a reduction in the level of absenteeism, less stress, and burnout. In many countries in the Caribbean, the health and well-being of nurses are threatened and in some cases negatively impacted due to poor working conditions and other factors in the work environment, such as staff shortage, poor communication and interpersonal relationships, and physical attacks or violence by patients, including those who are mentally ill. There is high workload in terms of the ratio of nurse to patients, lack of cooperation and teamwork, poor remuneration, job insecurity, employment on contract versus permanent establishment, and lack of recognition. Natural disasters. The Caribbean region is very prone to natural disasters. Nurses working in actual disaster situations can become overwhelmed and may have poor coping skills due to secondary trauma resulting from having to deal with other person's trauma. And there is the whole issue of the chronic non-communicable diseases. Positive practice environments are settings that support excellence and decent work. In particular, they strive to ensure the health and safety as well as personal well-being of staff, support quality patient care, and improve the motivation, productivity, and performance of individuals and organizations. That's according to ICN. Elements in a positive practice environments: occupational health, safety, and well-being policies, fair and manageable workloads and job demands, effective management and leadership practices, healthy work-life balance, equal opportunity and treatment, opportunities for professional development and advancement, professional identity, autonomy, and control over practice, job security, decent pay and benefit, safe staffing levels, support and supervision, open communication and transparency, recognition programs, access to adequate equipment, supplies, and support staff. And there are extensive body of evidence out there that confirms the relationships among positive work environments, job satisfaction and retention, and positive patient outcomes. And there are some of the benefits. We've mentioned higher employee retention rate, better teamwork, improved patient outcomes, job satisfaction, decreased rates of absenteeism and turnover, increased staff morale and productivity, improved communication and cooperation, feeling of being respected and valued. In terms of the Caribbean experience, we'll look at what Antigua and Barbuda is doing in terms of improving the health and well-being of nurses in that country. Now, there is a policy on vacation leave and sick days, which provide nurses with substantial time off from work for adequate rest and relaxation. A physical fitness program is conducted 3 days per week, to which all health professionals can attend for free. Healthy eating and healthy weight are advocated, and a national health insurance is proposed to be implemented sometime this year. At the professional organization level, it provides opportunities for social activities, resiliency training, and emotional intelligence training. Grenada has implemented an orientation sessions for new nurses and their assigned mentors. As we know, new nurses making a transition from studentship into beginning practice can become very stressed, and so they need support of mentors. Monthly medical evaluation for nurses. Health fair for nurses during Nurses Week celebration. Stress management workshops or seminars, counseling for nursing personnel, employee assistance program, recognition/award ceremonies. You have social activities like health fair and fun days, and debriefing after critical incidents, where nurses speak to a counselor about the incident, how it impacted them on an individual basis, and that counselor will take them through right up to the point of resolution. There is self-defense training was implemented last year for nursing personnel, immunization for healthcare workers, and there is a post-exposure prophylactic treatment for HIV in cases of needle stick injuries or being exposed to body fluids. This is a picture of nurses in Grenada attending a retreat and Grenadian nurses at a CPD session. Guyana, at the policy level, there has been discussions on having doctors assigned to take care of the health of nurses. Nurses showing signs of violence and depression are referred to a senior psychologist. There are plans to offer a package of comprehensive medical evaluation to nurses and midwives on a yearly basis. At the nursing schools, there are part-time counselors, social workers who work with students. The announcement of salary increases shortly for nursing personnel in Guyana, and staff shortage due to migration is causing burnout among the nurses. And in the interim, the Ministry of Public Health had been training patient care assistants to assist the nurses in providing basic nursing care. Jamaica. Jamaica provides 80% of insurance coverage to assist nurses in illness, diagnosis, and treatment. Assistance is provided for prescription drugs, medical consultation, laboratory, and other diagnostic procedures. It provides an accidental death and dismemberment benefit for nurses. Compassionate fund is available where healthcare professionals can access funds in cases of serious illness. There are grant schemes, example, vacation leave, sick leave, extended sick leave, emergency leave to attend to urgent matters. Jamaica facilitates a revolving loan scheme for motor vehicles, residential properties for nurses at a subsidized cost, and convenes sporting activities such as netball and football. Jamaica also acknowledges the work of nurses by hosting functions such as award ceremonies. Nurses Association of Jamaica represents nurses during industrial matters, celebrates International Nurses Day annually, and collaborate with LASCO group of companies to host nurses and student nurses of the year competition. The winners receive cash awards and other prizes. The Nurse of the Year is also awarded a Master of Science scholarship from the Ministry of Health. Nurses and their children enjoy a grant benefit of 13 million Jamaican dollars education grant. The CPD session, and there is a gym at the Nurses Association Business Office in Jamaica where nurses can participate in physical fitness session. And every August, there is a day set aside for fun. This is a picture of nurses participating in Orange Day March convened by the Nurses Association of Jamaica, and Jamaican nurses participating in a capacity building session. Montserrat has a health and wellness programs for nurses. They have health insurance system for employees, and they're also involved in sporting activities. For example, the nurses form a cricket team, and they meet once per week to play and send out challenges to other ministries. They have free medical care in the health system. They have healthy walks, hikes, their training, and the use of the performance appraisal provides incentives for nurses to perform better and be in the line for promotion. St. Kitts, Nevis, they have a staff clinic, immunization of the nurses, Nurses Week celebration, Christmas lunch, and they award EC $1,000 payable to 3 nursing personnel on a monthly basis. These nurses must demonstrate good interpersonal relationship with their clients, colleagues. They must be regular and punctual for duty, so there is a criteria. And they're currently lobbying for a daycare center to be attached to the main hospital. This is some nurses in St. Kitts and Nevis at the International Nurses Day Church service, and some nurses having a little fun time from St. Kitts and Nevis. St. Vincent and the Grenadines, they have administrative day off are given to nurses as a token of appreciation. 1 mental health day per month is given to all nurses working at the mental health facility. They have compassionate leave of 2 days or more given on the passing of a close relative. Every category of staff is given a day off once per year to participate in a social activity. All nurses receive study leave on full pay for 1 year, then half salary thereafter. Their tuition scholarships are available and other scholarship opportunities. And all civil servants, including nurses, have access to a specially designed 100% mortgage facility at the Bank of St. Vincent and the Grenadines at a special rate. These mortgages are bringing home ownership within the reach of civil servants who are first-time home buyers. Additionally, all nurses have access to construction of lower and middle-income houses. There are annual medical assessments. All staff are required to have medical clearance or fitness to work, and nurses are exempted from paying for medical care at public facilities. In Suriname, there is the development of protocols to guide practice, hand washing, for example, PPEs, protective equipment, renovation and remodeling of outpatient clinics, taking into consideration the safety and well-being of nurses. They have social worker who provides counseling for nurses with social problems and long-term illness. They have implemented the Care for Carers program, where nurses who have experienced a traumatic event in the workplace can turn to a colleague who have been trained to provide counseling services. There is also training in dealing with aggressive patients, so the nurses know how to act in situations where the customer is aggressive. And a flow chart showing the specific actions to follow is available at all departments. There is also a medical fitness program. The hospital has also provided staff and nursing with exercise program twice a week. They have also been given opportunity to swim. They have structured information sessions are held on infection prevention measures for nurses. And there is a quality guarantee commission that is also in place in terms of monitoring the health and well-being of workers. Encourage health workers to maintain a healthy lifestyle that includes a healthy diet and sport practices, regular evaluation of performance and refresher training, and the Psychiatric Center in Suriname has been providing 10 extra days of leave, what is referred to as household days, to all employees working in mental health facilities. In terms of disaster-related psychological trauma and mental health training is a project, a 3-year project between the University of the West Indies St. Augustine campus and Johnson & Johnson Foundation. The purpose of this project is to strengthen the capacity of nurses to deliver psychological trauma and mental health services to affected individuals while also maintaining the mental health and well-being and resilience of themselves and their colleagues. The project encompasses stakeholder consultation, train-the-trainer curriculum development and implementation, other capacity building initiative, and it culminates with a sustainable program leading to continuing education certification through the University of the West Indies St. Augustine campus. The objective of the project are as follows: development of a sustainable educational approach to preparing nurses to identify and address the mental health needs and or psychological trauma of individuals, including nurses, to create a pool of well-qualified nurses within the Caribbean with the requisite competencies to respond to psychological trauma, develop an educational approach that encourages interprofessional learning and cooperation. So far, a total of 28 nurses from the Caribbean were trained as trainers, and a stakeholder consultation was held last November with nurses and other personnel from across the region. This is a picture of some of the participants at the stakeholder consultation held last November. And in conclusion, I would like to say that the healthcare professionals' physical and mental health provides the foundation for their ability to provide safe patient care. When nurses are not recognized for the work they do, their well-being can be negatively impacted. Harmonious work environments and good interpersonal relationships positively impact their well-being. Thank you very much.
Thank you, Ms. Edwards, for your lecture. I think it's very important, your speech about well-being in nursing, especially for nursing students who are thinking to become a nurse and in what working condition they will work. So thank you. So I'm going to conclude now this session. I think Howard wants to tell something. After me? Okay. So we had 3 wonderful speakers with 3 different topics. And I think we get very important messages for us, for our professional work. And as I said in the start, each paper, each lecture, each poster here in this Congress counts. So I encourage you to be a participants in the other sessions and see you in the next main session. Thank you very much to all of you.
Thanks, everyone, for a great session. Just 30 seconds, colleagues, please. Tomorrow morning at 9 o'clock, we have a really important session. We've got the latest research from Linda Aitken. Linda's presenting with colleagues, but we've also got special guests from Patient Safety Centre and also from the World Bank. We've got a lot to pack in tomorrow morning. I know it's going to be a session you will not want to miss. Please, 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 if you can be in your seats for 9 o'clock tomorrow morning. See you in the morning. Enjoy the rest of your day. Thank you.
I never knew anybody till I knew